What if I told you that the cold, heavy, or tingling feeling in your legs right now is not just discomfort, it is your body quietly sending you an emergency signal that most people completely ignore until it is far too late? Here is something that will stop you in your tracks. Poor leg circulation is one of the leading silent contributors to heart attack, stroke, and limb amputation in adults over 40, and the most frightening part is that most people who have it do not even know it. They chalk it up to getting older, sitting too long, or being a little out of shape. But that explanation could be costing you your life. So in the next 20 minutes, I'm going to show you a simple 30-second test you can do right now, right where you are sitting, to find out if your leg circulation is compromised, and then I'm going to walk you through 3 fast science-backed fixes that you can start using today. Stay with me because the information in this video could genuinely change everything for you. Let us start by talking about what leg circulation actually means and why it matters so much more than most people realize. Your circulatory system is essentially a massive network of highways, arteries, veins, and capillaries all working together to move oxygen-rich blood from your heart down to your feet and then return that used blood back up to your heart and lungs. When everything is working properly, this happens seamlessly about once every minute. But when something interferes with that flow, the consequences start to stack up fast. Your muscles do not get the oxygen they need, so they cramp. The nerves do not get nourished properly, so they tingle or go numb. Tissue starts to break down slowly, which is why people with poor circulation often have slow healing wounds on their legs or feet. And here is where it gets really serious. The same plaque buildup and narrowing of arteries that is happening in your legs is almost certainly happening in the arteries around your heart and brain at the same time. This condition is called peripheral artery disease, or PAAT, and the American Heart Association estimates that over 200 million people worldwide are living with it, most of them undiagnosed. Now you might be wondering what causes this to happen in the first place, and the answer is almost never just one thing. Leg circulation problems develop over years due to a combination of factors that work together in a very destructive way. Atherosclerosis, which is the hardening and narrowing of arteries due to plaque buildup, is the most common culprit. This plaque is made up of cholesterol, fat, calcium, and inflammatory debris that gradually sticks to the artery walls and restricts blood flow like rust building up inside a pipe. Smoking is one of the most aggressive accelerants of this process because the chemicals in tobacco smoke directly damage the inner lining of your arteries and promote clotting. Diabetes is another enormous risk factor because chronically high blood sugar damages both blood vessels and nerves simultaneously, which is why diabetic patients are statistically the most likely to develop severe circulation problems in their lower limbs. High blood pressure forces your heart to push blood through increasingly resistant vessels, which accelerates arterial damage over time. A sedentary lifestyle contributes significantly as well because your leg muscles actually help pump blood back up toward your heart when they contract during movement. When you sit for long hours, that pump basically shuts off. And then there is excess body weight, chronic inflammation, and even certain autoimmune conditions that all play a role. The picture becomes clear very quickly. Poor leg circulation is not just a leg problem. It is a full-body systemic issue rooted in lifestyle, biology, and time. So how do you know if your circulation is actually compromised? This is where the 30-second test comes in, and I want you to do this right now as I explain it. The test is called the capillary refill test, and while it is not a replacement for a medical evaluation, it gives you a very meaningful real-time window into how your peripheral circulation is functioning. Here is what you do. Sit comfortably and extend one leg in front of you. Press firmly on the tip of one of your toes, the big toe is best, with your thumb for about 5 seconds until the skin underneath turns white or pale from the pressure. Now release the pressure and count how long it takes for the normal pinkish color to come back to that area. In a healthy person with good circulation, the color should return within 2 seconds, sometimes even faster. If it takes 3 to 5 seconds, that is a yellow flag and suggests some degree of sluggish peripheral blood flow. If it takes more than 5 seconds or the color does not return fully and evenly, that is a significant red flag that warrants a conversation with your doctor as soon as possible. You can also do a variation of this test by simply looking at both of your feet while you are seated versus when you dangle them over the edge of a chair. With good circulation, the color change between the two positions should be minimal. With poor circulation, dangling the feet often causes them to turn a dusky reddish purple due to gravity-dependent pooling of blood, while elevating them causes them to turn very pale very quickly because the pressure is not sufficient to push blood against gravity. These observations together give you a remarkably useful snapshot of what is happening inside your vascular system. And honestly, if you are sitting there right now, noticing that your toes are regularly cold, that your feet look bluish or mottled, that you get a cramping pain in your calves when you walk, that goes away when you rest, those are classic textbook signs of poor leg circulation that should not be ignored. Now let us move into the part of this video that you really came for, the 3 fast fixes. And I want to be very clear about something important before I explain these. When I say fast, I do not mean they work in 5 minutes and then you forget about them. I mean that you will feel a difference quickly, sometimes within minutes for the immediate strategies, and within days to weeks for the deeper ones. These are not gimmicks, they are physiologically sound approaches that are backed by research and used by physicians, physical therapists, and vascular specialists around the world. The first fix is something called contrast hydrotherapy, and it is one of the most underused, most powerful circulatory tools available to anyone with access to a shower or bathtub. Here is how it works. You alternate between warm water and cold water on your legs in a specific pattern, and this alternation creates a pumping effect on your blood vessels. When warm water hits your skin, your blood vessels dilate. They open up wider because your body is trying to release heat. When cold water hits, they constrict, they clamp down to conserve warmth. When you alternate back and forth, you are essentially making your blood vessels exercise. They are expanding and contracting rhythmically, which drives circulation in a way that passive sitting or even light walking cannot replicate. The protocol is simple. Start with warm water on your legs for about 3 minutes, warm enough to be comfortable but not scalding. Then switch to cold water for 30 to 60 seconds, cold enough to feel the shock but not dangerously icy. Repeat this cycle 3 to 4 times, always ending on cold. You can do this in the shower in about 12 to 15 minutes. Studies looking at contrast hydrotherapy in patients with chronic venous insufficiency have shown meaningful improvements in blood flow velocity, reduced leg swelling, and decreased feelings of heaviness and fatigue in the legs. For people who have mild to moderate circulation issues, doing this 3 to 4 times per week produces noticeable results within a couple of weeks. Even if you are just starting, doing it once and then going for a short walk will make your legs feel more alive than they have in months. This is not about being tough, it is about using temperature as a tool to wake up a sluggish vascular system. The second fix is targeted ankle and calf mobility work, and specifically the exercise protocol developed around what is sometimes called the calf muscle pump. Here is the physiological reality that makes this so important. The veins in your lower legs have one-way valves in them that are designed to prevent blood from flowing backward away from the heart. But veins, unlike arteries, do not have their own muscular wall to push blood along. They rely almost entirely on the surrounding muscles to squeeze them and drive the blood upward. The calf muscles are by far the most important contributors to this function. Every time your calf contracts, it squeezes the veins that run through it and pushes blood up toward your heart. When you sit for long hours, those muscles are inactive. The pump stops, blood pools in the lower legs, and the pressure in those veins rises. Over time, this leads to swollen ankles, spider veins, varicose veins, and in more severe cases, dangerous blood clots. The fix is to make calf activation a regular, deliberate habit throughout your day. The most effective exercise for this is ankle pumping. Simply sitting in your chair and repeatedly flexing your feet up and down, pulling the toes toward your shins and then pointing them away. Each full cycle of flexion and extension produces a meaningful squeeze on the calf veins. Doing 30 of these every 30 to 60 minutes of sitting can dramatically reduce blood pooling. Pair this with calf raises, standing and rising up on your toes slowly, holding for a second at the top and lowering back down. Done for 2 to 3 sets of 15 repetitions several times a day, and you are creating a powerful zero equipment pump for your entire lower leg venous system. If you want to take this to the next level, try doing your calf raises on a slight incline or with one leg at a time to maximize the muscular recruitment. Research from the Journal of Vascular Surgery has shown that regular calf muscle activation significantly reduces venous pressure and improves symptoms of chronic venous insufficiency. This is not a complicated or time-consuming fix. It is something you can layer into your day without rearranging your life. The third fix involves your diet, and specifically focusing on 3 nutritional strategies that have direct measurable effects on vascular health and blood flow. The first is increasing your intake of nitrate-rich foods, primarily leafy greens like spinach, arugula, kale and beets. When your body processes dietary nitrates, it converts them into nitric oxide, which is a signaling molecule that causes your blood vessels to relax and dilate. This is the same mechanism targeted by many prescription medications used to treat cardiovascular and circulatory conditions, except that dietary nitrates do it naturally, gently and sustainably. A beet and spinach smoothie in the morning is genuinely one of the most vascularly supportive things you can eat, and clinical trials have shown measurable improvements in peripheral blood flow within hours of consuming nitrate-rich foods in sufficient quantities. The second dietary strategy is aggressive omega-3 fatty acid intake. Omega-3 salts, found primarily in fatty fish like salmon, sardines and mackerel, as well as in flax seeds and walnuts, work on multiple vascular fronts simultaneously. They reduce systemic inflammation, which is one of the primary drivers of arterial plaque progression. They decrease blood viscosity, making the blood slightly thinner and easier to push through narrowed vessels. And they improve the flexibility of red blood cell membranes, allowing those cells to squeeze through tiny capillaries more effectively. Aim for at least 2 to 3 servings of fatty fish per week, or consider a high-quality fish oil supplement, standardized to at least 1 gram of combined EPA and DHA per day, though always discuss supplementation with your healthcare provider first. The third nutritional approach is dramatically reducing your intake of refined sugars, trans fats, and highly processed foods. This might sound like general health advice, but when it comes to circulation specifically, these substances are actively toxic to your vascular system. Refined sugar spikes blood glucose, which glycates proteins in your arterial walls, making them stiff and prone to damage. Trans fats raise LDL cholesterol while lowering HDL, creating the exact lipid environment in which arterial plaque thrives. Ultra-processed foods are loaded with sodium, which drives up blood pressure and causes fluid retention that worsens leg swelling. Removing these from your diet is not just about weight or general health, it is about stopping the ongoing chemical assault on your blood vessels so that your other interventions can actually work. There are a few additional things worth mentioning that can significantly accelerate your progress. First, if you smoke, stop. I know that is easier said than done, but no circulation intervention will be fully effective while you are actively destroying your arterial walls with every cigarette. The carbon monoxide in cigarette smoke reduces the oxygen carrying capacity of your blood, the nicotine causes immediate and powerful vasoconstriction, and the thousands of chemical byproducts promote clotting and inflammation in ways that are uniquely devastating to peripheral circulation. Second, if you have been prescribed compression stockings or socks by a doctor, wear them consistently. Medical-grade compression garments work by applying graduated pressure to the lower leg, which physically prevents blood from pooling and assists venous return. They are unsexy and occasionally uncomfortable, but they are genuinely effective. Third, be very intentional about elevation. Anytime you are resting, watching television, reading, sleeping, prop your legs up above the level of your heart if possible. Gravity is not your friend when your veins are struggling, and positioning is a free, effortless way to give your circulatory system a mechanical advantage. And finally, do not underestimate walking. Even gentle, slow, consistent walking stimulates the calf pump, promotes arterial blood flow, and sends signals to your body that blood vessel maintenance is a priority. You do not need to run marathons. A consistent 30-minute walk most days of the week is one of the most evidence-based interventions for improving peripheral circulation and reducing cardiovascular risk across the board. The core message of everything we have covered today is this: poor leg circulation is not an inevitable part of aging, and it is not something you have to simply live with, but it is also not something you can afford to ignore. The 30-second capillary refill test gives you a meaningful first look at where your circulation stands right now. The 3 fast fixes, contrast hydrotherapy, calf pump activation exercises, and targeted dietary changes give you real physiologically grounded tools you can start using immediately. Together they represent a genuine practical path toward better vascular health that does not require expensive procedures or waiting rooms. If you found this information valuable today, please make sure to subscribe to the channel so you never miss a video. Give this a like if it helped you or someone you know, and drop a comment down below telling me what health topic you want me to cover next, because your questions and your feedback are exactly what drives this channel forward. Your circulation, your heart, and your future self will thank you.